Hello, and we are live. Welcome back to The Spark is Love. This month, we're going to have our topic about respiratory health. These are monthly classes focusing on your health is your wealth. So I hope that we're going to have a great time today. My name is Casey Pacheco, and I am a registered nurse. I've been a registered nurse for about a decade, and I am really presenting these classes to my family who are here, my friends, my mom's friends, my sister's friends. And so I feel really comfortable discussing these topics with you in a very simple and practical manner. Today for respiratory health, I will just go ahead and be very honest. This was a very difficult topic for me because respiratory health is not something that I have a problem with. And we say if it's not broken, don't fix it. So that's the mentality of the current health system. People go for medical care because something is wrong. However, these classes are aimed at preventative care. So you're not coming here, you did not show up because you necessarily have a problem breathing. And that's a very difficult thing for me to understand. However, going through COVID-19, we realized that respiratory is important because if we cannot breathe, we cannot live. So I really, my personal awareness and personal journey was elevated. And so I'm taking you on my journey. And I really hope that this information with my medical background will be of interest to you. Okay, so just getting a little bit into my intention as to what I really aim for this class. I don't want to just give you facts. I don't want to just tell you about just cold hard what is, but I really want to educate you, engage you, energize and empower you to take care of your own health. If you were with me for our past class, pain management, you would see I'm really putting you in the driver's seat and you're the one making decisions for your health care. So I'm just on the sidelines cheering you on, and I'm giving you the tools so that you could stay as the main character in your health journey. So I hope that this is important. This is going to be helpful. And we're really going to just start at the basics as to what is breathing, what is happening. So it can be very complicated, but I'm making it very simple. So you're taking air, you let out air, but it's really an exchange of gases. So you're breathing in oxygen and you're letting out carbon dioxide. Now, it seems simple, and most people say, well, that's just automatic. Honestly, there is not much I can do about that. However, I'll just give you a little illustration. If you have something automatic, like if you were a child, you're going to school, well, every student, they enroll in class, then they attend, they graduate, and hopefully they have an education. So that's a really automatic process. But at the end of it, everybody, the level of education they come out with is different. Even if you had the same process, everybody will always be different because there are so many different factors that actually contribute to the outcome. So the outcome of our breathing, if you apply that to breathing, there are different things that actually make that can make it effective or non-effective. And some of the things that really play into how well we breathe fall under two categories. You have the air quality, and then you have the function of your equipment, which is the lungs itself. So let's dive into the air quality. Now, of course, we know we've been wearing masks for a long time, and that's because of coronavirus. So you have the viruses and bacteria within the air, and you also, in addition to coronavirus, you have colds, flu, pneumonia. All of that affects the way we breathe. Also, you have irritants. So you have irritants such as chemicals. Some people, they've been painters, they work with harsh chemicals all their life. That affected them. Or some people are exposed to smoke or actual smokers, big effect. Also, you have your natural or environmental irritants, such as pollen, dander, etc. And then air pollution. Now, air pollution is something that we don't really think about, especially if we're not in like an industrialized country. But the World Health Organization actually said that 91% of the world are living in polluted areas. They don't meet the standard. And what was actually fascinating that it did not matter if you are in a developed country or a developing country, it's the same. Air pollution affects us the same. I was even surprised to find out that air pollution was more indoors than outside. Very interesting. So air pollution affects our breathing. It affects the air quality. Now let's go into our equipment, our lungs themselves. Asthma, COPD, cancer, the list goes on. If give you a simple illustration, like you see, I have a picture up here about broccoli, and a lot of people say, well, what's the broccoli doing there? Well, broccoli is a really good physical demonstration of what's going on in our lungs, because our bronchioles, or the point where the gases exchange, look like broccoli, where with each crown having just a little head. That's where you call the bronchioles. Now, diseases such as asthma, COPD, cancer, it affects that bronchioles. So it's like you see the picture on the right where there are no bronchioles, or it's closed. So the gases cannot go through. So when you have these disease processes happening, right, you're actually breathing, but there is no exchange happening. Oxygen is not getting in your body and it's not getting to your lungs. So that actually is an emergency. And this is the point when the disease processes happen, is when most of us seek medical care. We can't breathe, and you show up to the hospital and you want treatment. Well, your provider, they're going to treat your disease, the disease, asthma, COPD, whatever is going on, respiratory. That's their focus, because they want you to breathe. And there are many medications that they use to help you to get that breathing process happening. So many medications, but we're going to keep it simple, and we're going to stick to one class of medication, and that's called bronchodilation, bronchodilators. Now, in the United States, in my practice, I have seen albuterol used so many times. No matter what the disease, albuterol is the drug of choice. And that's because this medication works to open up and allow oxygen in. I usually give my patients this illustration. I tell them, think about, you have a nice little puppy and your friend come over, and your puppy don't know your friend. So the puppy starts, wanting to protect you, becomes this big guard dog. And then when you look outside and you realize it's not an intruder, it's just your friend, then you start patting the puppy and you say, calm down, calm down. And then this cute puppy who turned into a guard dog now switches back and starts wagging its tail and sniffing you. Well, albuterol works sort of like in that same manner. The lungs, from stimulus or not working, it seizes up and it does not let oxygen in. It closes either part ways, or for some people, unfortunately, it closes all the way. And albuterol, what it does is like telling your body, it's okay, it's just oxygen. Let oxygen in. And so then it opens up and then you can breathe freely. So this is an emergency situation. This is what we usually do in the hospital. And this is just an idea of how your breathing treatments work to help you to breathe correctly. Now, I will say it again as a disclaimer. This class is not intended for emergency use. So if you are currently experiencing breathing problems because of coronavirus or because of disease, please go to the emergency room. This information is aimed for preventative health. We touched on what happens in an emergency situation just so that we could be proactive and know, well, what are some of the things that we're going to do to not reach there? How can we maintain good breathing and not have to end up in the emergency room? Okay, so in the medical field, we know to avoid triggers, but that's just one of the things that we can do. So we're going to jump actually into nursing care and see what else could be done to help. Okay, so nursing care. So a lot of us are already familiar what the doctor does. The doctor orders the medication. The doctor watches to see how that medication interacts with our body to make sure it's working. Now, many people say, okay, so what does the nurse do? Give me the medication. Yeah, we give you the medication. But nursing is not just limited to giving the medication. So just a little tip, the doctor, so you can know the difference, a little tip. The doctor is taking care of the disease. The nurse is taking care of the entire person. So as a nurse in caring for you, yes, I want to give you that medication, but I am going to do a series of things to make sure that that medication is going to work well for you. And here is where we create a nursing diagnosis. So usually, depending on who you are, you may have multiple levels of nursing diagnosis. And we'll just talk about one today, ineffective breathing pattern. So an example of some of the interventions that are done for ineffective breathing pattern would be making sure the patient is well positioned, making sure the area is well ventilated and not cluttered, right? Making sure that every 2 hours that they turn, they cough, they deep breathe, and really managing that patient, their energy, their anxiety, their visitors, takes a lot, right? And then we'll do the teaching, making sure that they know what their triggers are, and then they know practically how to avoid it. And we want to teach you so that you can do all of this at home. And some people are like, well, that's what the nurse does. That seems like common sense. Anybody can do it. Well, if that's what you're thinking and what you're feeling right now, then I am doing my job, because every nurse wants to educate you so that you can take what you learn in the healthcare environment at home. We want you to do it at home. So we want to break down really, really complex topics and complex actions and make it really, really simple and doable so that you can do it. Now, simple is effective, but simple is not always easy, because these simple actions require consistency. See, consistency is what gives you successful outcomes. So if it seems simple and you're getting teaching, for example, a teaching that we do is incentive spirometry, which is really an exercise for your lungs. It's easy to take it for granted, but it is very, very effective. So if you are a person who have been, or you may end up in the hospital, I will encourage you to really pay attention to these simple teachings, the things that the nurses are doing for you, encouraging you to cough, deep breathe, so forth. Really pay attention so you can go home and you can do it, okay? And the people attending this class, they are proactive. They want to take care of their health. They want to do things. You want to do things to take care of your body. So I'm putting you in charge and I'm telling you, pay attention to the simple things. So we talked about medical care, we talked about nursing care, and we talked about how they differ. Let's explore together holistic care. Now, holistic care, for some people, it might be foreign, but for most of you attending today, you are aware of not just caring for the disease, but you're aware of caring for your whole body, your mind, your environment. And a lot of you here today, you are even interested in natural solutions to take care of yourself. And under holistic care, we have the branch of complementary alternatives. And these are therapies such as chiropractic care, massage therapy, acupuncture, aromatherapy. They can be used by themselves or they could be used together integratively with standard medicine. And so many people have benefited from these therapies. Today, related to respiratory health, we're going to talk about the last one we have here, aromatherapy. And aromatherapy, it is very, very helpful for people who have respiratory problems, not just because that gas exchange is not happening. That's not the only thing going on. Think back when I talk about that guard dog. If your cute little puppy turns into a guard dog, your friend has anxiety. They're running in the next direction. So think about if one day you cannot breathe, it's not just you cannot breathe. The act of not breathing creates so much anxiety. And this is where aromatherapy can come in. Aromatherapy really helps to reduce and avoid panic. What I've done is that I created a video. I had an interview with a beautiful, beautiful friend. Her name is Danny Flynn. I'm sorry, Danny Flynn. And she is a doTERRA consultant. And we had this pre-recorded interview because she is a person that she wanted to take her health in her own hands and really take responsibility for caring for her body. And she has achieved better health outcomes by using essential oils. So I am going to connect this video so you can watch the interview at this time. Welcome back to The Spark is Love. Today, we have an exciting interview with Danny Flynn. She is a doTERRA consultant, and we're going to jump right into the interview. Welcome, Danny, to Health is Your Wealth session. We are so excited to have you here.
Thank you so much. I'm excited to be here.
Yes, today for our topic of essential oils, we're going to dive into a little bit of aromatherapy and talk about how essential oils relate to respiratory health. While essential oils do not claim to prevent, treat, or cure any disease, they have really been making their mark on the wellness industry. So you personally, Danny, you have jumped into the driver's seat and you are taking good care of yourself. Can you tell us a little bit about yourself and some practical things that you do to care for your breathing and reduce any stress or anxiety?
Yeah, for sure. Well, first of all, thanks again for having me. It's always a pleasure. So I was introduced to essential oils about 3 years ago, and I jumped all the way in. doTERRA has some amazing products, and I use them all. And so I have asthma. That's something that I struggled with pre-doTERRA. So I use lots of the oils that I'll talk about today. I use a lot of those in my daily routine, and then as needed if I'm in need. And then for anxiety and stress, every single day I'm oiling up. In fact, that's what I did right before you hit record. I'll smell it. I'll put it over my heart. I'll put it on the back of my neck along my spine. So just I believe in using the oils before you need them, right? So it's an everyday process for me. If you know you struggle with something like anxiety or you have respiratory issues that are constant, then you want to be proactive with the use of the oils. And so, I use them in the 3 ways that you can use doTERRA oils, or aromatically, topically, and some of our oils you can even use internally. And so I've educated myself. I really have, like you said, tried to get into the driver's seat for my own health to try to figure out what my needs are, and then how I can meet those needs naturally. So
that's wonderful. That's wonderful. Well, you're a good example. And that's who we're trying to improve our health. We're trying to emulate good practices, good health wellness practices. So can you tell us how the oils interact with like the mind and the body? Is there like a balance there?
Yeah, so it really works in 2 different ways. The first thing it's important for people to understand, and I'm sure you talk about all the time, our bodies are incredible. They are incredibly designed creations, and they are always trying to achieve a state of homeostasis. They're trying to balance itself out at all times. And so the body, our intelligent bodies, recognize these essential oils. They recognize the chemical constituents of the oils, the properties of the oils. And so when you use them properly, your body knows exactly what to do with it, right? And so it's using it in 2 different ways. It's kind of a little bit of chemistry. But our bodies are made up of nothing but cells, right? And so these essential oils are able to get into the cell, right, past that cell membrane, and promote healing from the inside out. It also works with the body to help it to maintain a state of homeostasis. So when it comes to something like respiratory support and you're using the oils topically or aromatically, it's literally getting into your cells to help promote clear airways and to help you breathe even better, really to help those cells work at their best. So that's how it works with our bodies. Now with our minds, this is what aromatherapy is. So we have some nerves here called the olfactory nerves. And so when we smell these essential oils, those olfactory nerves are triggered, and then it communicates with the limbic system. And that's the part of the brain that controls, our mood, our emotions, our memory, all the things, all the craziness, the good and the bad happens in the brain, right? And so the essential oils are smelled, and those properties of the oils are registered in the limbic system. And then the limbic system, the brain, then sends out signals to the rest of the body to calm it down or to stimulate it, whatever the body is in need of. And you use the appropriate oil, it's going to help achieve that balance. So if you're looking to be, if you're a little down emotionally, then you want to reach for a citrus oil or a mint oil. Those are stimulating, they're uplifting, right? If you are a little overexcited, you're anxious or you're nervous, you're stressed out, you want an oil like, you want to pull your grounding oils like tree oils and florals, very grounding, very calming. So as you start an oily journey, right, you'll learn which oils, how to pair them, and then how to use them to achieve what it is that you're looking for. But yes, amazing both for mind and body.
That is awesome. Thank you for sharing. That is really good information. Dealing specifically with respiratory health, I heard the word on the street is that doTERRA has an awesome breathe line. Would you recommend any of these products for people struggling with respiratory health issues?
Absolutely. Breathe has been amazing. And it is a product line. There are several components to Breathe. But what Breathe is I have a bottle here. It's a blend of several essential oils that alone, these individual oils alone, are known to help with your respiratory system. So probably not surprising, oils like eucalyptus, right, like peppermint, are going to be found in this blend. And so doTERRA is all about the science. Let me tell you, they researched these oils to death. And so what they found in their research is that when you combine certain oils, then the effect is even more powerful. It's even greater. And so they pulled these oils together, eucalyptus, peppermint, several other oils, some that you probably are not as familiar with. And they combine it together for this blend called Breathe. It's amazing. So for those of us that have asthma, I have seasonal asthma. It's triggered by pollen and things like that. So I always have a bottle of Breathe with me. The moment I feel my chest start to tighten up, that's my first indication of an asthma attack. I will take Breathe and I apply it directly to my chest. You can dilute with the carrier oil if you have sensitive skin, or if you're using for a baby or an elderly person, and I just massage it in. You can also do the same thing on your back, have someone put a little bit on your back, massage that in with the carrier oil, and it just opens up the respiratory system. You can also kind of put it, that will be topical. You can also use it aromatically. You can put a drop or two in your hand, rub it together, and just breathe it in. It just opens up those airways, clears out those sinuses. You can also put it in a diffuser in that way. And again, it helps to open up the airways. And ironically, I don't know if I told you this or not, because we talked about this interview last month, I think. But this month, doTERRA's monthly promotion is Breathe, which I think is quite ironic, right? So, with for anybody that is interested in getting started this month in June, with qualifying orders, you will get a kit for free that's strictly for respiratory support. So you'd get a 15 milliliter bottle of Breathe. There's 250 drops in that. You'd get a 15 milliliter bottle of peppermint, 250 drops, and then you'll get a roller bottle of Breathe, and that is pre-diluted with coconut oil. This is the one that you can kind of carry with, or use it, with your babies or your elderly friends, pre-diluted. And it also comes with respiratory drops, qualifying orders, so that we can get it internally. Yeah, I love these. So isn't that funny that's the offer this month? So yeah, the line has been incredible for people who suffer with allergies, who have things like asthma. Also really good for spouses that snore. So
that's good to know, because that's respiratory as well.
It's respiratory. So a lot of people are like, oh, my husband stopped snoring when I put the Breathe in the diffuser. So all good for that. It's also really good on the bottom of the feet to help open up the respiratory. I know a lot of people, that's kind of odd, but it works really, really well for that. So I am a huge, huge fan, huge advocate of Breathe, and it's a great month to try it.
Wow, that is wonderful. Now, that was just coincidence. I did not know about that. But for all you who are listening, you have a bonus. Now, this leads me to my next question for Danny. Where would we go to find your information? I have some viewers who are watching from other countries. How will they get in contact with you?
Yeah, so I'm pretty active on Instagram, so you can always follow me there. Hey, Danny Flynn. That's my tagline everywhere. It's Hey, Danny Flynn. I have a website, heydannyflynn.com. Have an email, danny@heydannyflynn.com. And I think you'll add in my phone number if anybody has any questions. But I'm most active on Instagram, so you can follow along with the shenanigans and learn all the oily things.
That is wonderful. Now, Danny, I actually personally follow you on Instagram. So many helpful things. You actually posted something that I thought was amazing. It was a technique that a provider showed you. Would you mind sharing a little bit? I hope I'm not putting you on the spot.
I did not. I'm like, I printed it out somewhere. Let me find it.
Okay.
Yes. So I have an integrative doctor, which I recommend everyone has. So he does, traditional medical stuff, but he also is very, very open to holistic stuff. holistic alternatives. And so I was a little concerned about my blood pressure. It was a little high when I went in, and I was like, well, this has been a concern in the past because of past medications that I was on. And I said to him, like, do you think that I need to be on blood pressure medicine? I had a previous doctor who prescribed it. And he said, no, I think you need to breathe. And I thought, okay. So he gave me this technique. It's called the 4-7-8 exercise. And basically what that is you breathe in through your mouth. You breathe in through your mouth, and you count to 4 as you breathe in. So it's right. And when you get to 4, you hold your breath and you count to 7. Right. I'm going to let you do it so I can talk. And then when you get to 7, you slowly release through your mouth at a count of 8. Right? And so
it feels good because I'm nervous already. It's wonderful.
Right. If you do that whole thing, so the breathe in to 4, hold for 7, breathe out for 8, that's a count of 1. And then you would do that up to 4 times back to back. Mm-hmm. Right. And they recommend that you do it kind of like sitting up with your back up against the wall, in a quiet space. They tell you to hold your tongue on the back of your teeth like that when you're doing it. Mm-hmm. Mm-hmm. And when you breathe out, you use a whooshing noise like. Don't do it at work. People might think you're weird. Yeah. So, and I can give you this, Casey, to post somewhere, all of the instructions. But it's basically a natural tranquilizer for our nervous system. Isn't that amazing? You can calm yourself down simply by breathing. I just think it's so amazing. And you cannot do it too much. You cannot, the more you do it, the more effective it is. And they just recommend that you do it in a set of 4 when you first start. And then you can add to it as you go, because it does take some getting used to. And by the time you get to your 4th breath, when you first start, you can be a little winded. So a little lightheaded. So just, take your time and breathe, and it just brings you down. And when I do that, I also combine with oils that are really good for anxiety, which is something that I deal with. And when you have respiratory issues,
yes,
you get anxious. Yeah,
very anxious. Mm-hmm.
Which then just makes the even more difficult for you to breathe, right?
Yes.
So when I do my breathing exercises, I like to use what we call the ABCs. The ABCs of essential oils. That's adaptive. It's our calming blend. You can't really see it, but it's our calming blend. Balance is our grounding blend. Yeah, that was awesome. And Copaiba. This is doTERRA's response to the request for CBD oil. Very, very, very calming to the neurological system. Yes, yes. So a combination of those oils as you breathe will change the game. Will change the game for you. So.
This has been so wonderful. Thank you for sharing your information with our friends out there. It's just a really nice supplement to any medical or preventative things that they can do to help them. I really enjoyed. I learned so much, so I appreciate you sharing your knowledge. And hopefully, maybe for a different topic, we can have you back again.
I would love to. Thank you so much. And thanks for the work you do. I think it's so important for healthcare providers to show that there are other alternatives. So kudos to you. Really.
Yes, actually, when I was in Charlotte, in the hospital I worked, we used aromatherapy. We used oils for ourselves and our patients. So I really loved it.
Yeah, that's awesome.
Well, thank you so much. And I hope you have a wonderful time with your oils.
Thank you. Thanks for having me. Bye.
Bye. Okay, I hope you enjoyed that as much as I did. Hopefully you could have seen in my face, I really enjoyed that interview. I learned so much. Like I said, we use oils in the hospital that I worked previously, and it does a lot. In this class, it's presented from The Spark is Love, because the spark is love. I'm not endorsing any particular brand. or therapy. I'm just presenting what is out there for you to care for your own health. I personally, I use doTERRA. It's not the cheapest, but a little lasts a long time. I've had mine for like 3 years. So it's a really good brand. For me, I've used it. If you want, Danny's information is going to be posted to my Instagram, and also it's going to be posted in my YouTube comment section. So essential oils, it works. Now that goes into other things that we can do as we take in charge of our health. And when you get into alternative therapies, you usually find some people, they are either really for it or really against it. Well, being for it is not a bad thing. However, we have to know how to do our research. It's easy to research, but our research, if it's limited, we can actually get into a little bit of trouble. So I'm just going to give some helpful tips on what you're going to research. You're going to research the type of treatment. You're going to research the provider or the company. You're going to research the product, the services provided, and testimonials, because you want to know how other people are interacting with it. And now with the internet, you can get those testimonials. Something that I have found helpful while I'm doing research is to enter research with an open mind. Some things, this journey, like I told you before, this is my healthcare journey, and even welcoming you to the Spark is Love. It's an act of love, because my thoughts on healthcare at this time is healthcare. Healthy people take care of healthy people. So I am on a journey to take care of myself and my family, and I want to take you on that journey with me. I know you're on your own journey, but hopefully our paths could collide. So as we're taking care of ourselves, this is all good information, but what are some practical things that we can do even today to help ourselves? Well, Danny mentioned the 4-7-8 breathing. I don't know if you did it along with her. I tried it. It really calms you down. Sometimes you just need to breathe. Some other things that we can do, or some things I have done that you can try if you like, natural air purifiers. Now, I'm not a plant person. I do not have a green thumb. But these plants they're awesome. So snake plant, aloe plant, those are just two. They're a whole list. So depending on where you live, you can do some research into natural purifiers. Snake plant and aloe plant, let me say, they are easy maintenance. You water it just about once a week, and it does not need tons of sunlight. So even people who don't have a green thumb like me can do it. But these plants, what they do, they take out toxins from the air. Remember, I talked about air pollution and indoors having more pollution than even outdoors? Well, it's because of plants. So these plants, what they do is they pull like formaldehyde and all the stuff that we're not aware of. They actually pull it out of the air, and so we can breathe well. I tried it. So I bought me a snake plant. We recently just moved, and this apartment, I guess somebody smoked in it before. So I put the snake plant everywhere I could smell the odor. And the next day, the odor was gone. So I'm bought. I believe in it. So I have it all around my house. And aloe plant, it does the same thing. They both work very well. So it's maybe something you can try. Simple thing, needlepoint moves, just towards better health. Something else that works is nutrition. So foods, apples, spices, turmeric, cayenne pepper, ginger. Now, some people who are struggling with chronic disease, such like asthma, they may notice In a short term, drinking a cup of coffee may help them actually open up and breathe better. You have those beta cells. But in the long term, improving your nutrition, and it's hard, trust me, it's hard. But small things, add in small things such as these little spices, incorporating turmeric, I put it in my eggs, can really help in the long term with maintaining your lung function. I made actually a video. I call it Energize Me Smoothie. And I made it when my husband had coronavirus because I just wanted to get all of these in all at once. And I actually made a pre-recorded video to show you how I make this smoothie. It is delicious. You're going to love it. I think you should try it. But I'm going to show you the video now so you can try at home. Welcome back to The Spark is Love. In today's kitchen recipe segment, we will create our delicious Energize Me smoothie. Let's get started. Okay, so for our recipe, you're going to need a pineapple. What I do is I cut up the pineapple and I put it in the freezer. And so I have some already cut up. And a green apple, you can cut those up. And sometimes I just put this in the freezer as well. And I had some frozen mangoes or whatever. I'm Caribbean, so I like mangoes. And I put about half a cup of pineapple, half a cup of mango, 1 whole cup of, or just 1 green apple, and about 1 cup of spinach, and we're going to need some orange juice, 1 cup of orange juice. And you can do a whole banana, but I'm just going to do half of a banana because this is a pretty big banana. Banana, it adds sugar, but it can be a little overpowering sometimes. So now that I have, this is a really quick smoothie, especially if you cut up your fruits and you freeze them in the morning before you exercise or before a walk, or just start your day. You can get this together pretty quickly. In this smoothie, there's so many good health benefits, not just the fruits, but I also add, let me just put everything over here, pineapples. And there's a way to layer your smoothie, but I'm not the greatest. I just toss everything in. Woo, okay, and I put my juice in. So this is a cup of orange juice. And this smoothie is delicious, but back to the health benefits. In addition to the fruits, I use turmeric, organic turmeric, and I just use just about a teaspoon. I don't measure, I just dash it in there. And black pepper, which activates turmeric for it to work, and also cayenne pepper. And we talked about this in our respiratory segment. And I just do a dash. Not too much because it's a little goes a long way. And you don't want to alter the taste too much. So everything is in here and it's ready to go. And I just put it in my blender. What just let it sit for a while. But usually if I'm in a hurry, I just add a little bit more liquid. That's it. And you don't have to use frozen, you could use chilled. That's gonna be good. So it's nice, you see it's nice and green color, and you have your good stuff in there. And I just pour it over. Some for me and some for my hubby. None for the baby just yet. And here we go. And I cannot wait to taste this. Okay, there we go. Honey, you want to taste?
Yeah.
Ooh, it's good.
Really great consistency.
Yes. The baby's just waking up. So you have Energize Me smoothie. I think he's gonna want some. And that's it. Very simple. This smoothie was actually made as part of our Improving Respiratory Health class. Please be sure to check out the entire video where we talk about the benefits of the ingredients that went into this smoothie and how it relates to improve respiratory health. Thanks for joining. Bye. Okay, so that was my Energize Me smoothie for the mom by Anthony and Jaira. But you know what? They enjoyed it. That thing is delicious. And just a tip that I learned, don't freeze all your fruits because that took forever to blend. It took forever to blend, but if you leave it to sit out for a little bit, it blends up really well. Okay, so we're gonna just wrap up our class today. I hope you really enjoyed it. I hope I met my aims and intentions of the class, to just really show you that your choices that you make, the simple choices that you make, whether it be conventional or alternative, can really improve your lung function. And I hope I gave you a nice little overview, not overwhelm you, but give you a nice overview as to if you do have to go to the hospital, what to expect and how you can work along with your providers and get in the best outcomes. And from Danny, we learned a lot about essential oils and how they impact our breathing. And today, if you could walk away choosing one thing that you want to work on, just to show gratitude and awareness for the ability to breathe. Our lungs do so much for us every waking moment. Even when we're sleeping, we're breathing. So if you could walk away and say, hey, I'm going to do one thing for my lungs, then I would have met my objective today. I thank you so much for coming. Our next class is going to actually be on Saturday, July 17th at 2 p.m. Eastern Standard Time. What I have done is I made it standardized. So every month, the third Saturday, we're going to have our classes at 2 p.m. And we're going to get real next class. We're going to be talking about care for the caregiver. And that's a big, big topic because no matter where you live, we're caring. If you're caring for yourself, most times you are a loving person and you're caring for others. And I want to help take care of you. So I am so happy that you were able to join today. Any of the videos, you can always check back or reference YouTube. We're going to break it up. But I thank you for being here, whether you're here on the live or you are tied in on one of the other platforms. I do welcome you. I hope you stay along for our journey, and I am going to open up the floor for any questions or comments at this time.
I have a question.
Yes, ma'am.
I wonder if I could invite, I thought it was very informative. I really enjoyed how simply you put it across. And I want to know if I could invite 1 or 2 friends from the whole.
Yes, you could invite as many people. On our live stream, we have room. We welcome everyone. And if you just even want to show them a replay, you could send them the link to YouTube. So either way is fine.
Oh, all right. Then. Thanks a lot.
Thank you for coming.
But I have to learn how to breathe. I never knew how to breathe properly. I never knew how to breathe properly. I think I know we'll have to practice this.
Yeah.
Okay.
Yes, Mommy, you have something you wanted to say?
Yes, I want to say thank you so much for the aromatherapy because I've never used it, but I really have different oils and never put them to use. And at one time I wasn't feeling too well and I used a little bit of peppermint oil right by my neck. And I find I felt so good. So I believe the essential oils are very healthy.
Yes.
So thanks for that part of it. And all the others were very nice and interesting. Thank you very much.
You're welcome. Thank you for attending.
You're welcome.
They say in nursing, the first thing they say is, you have to treat everyone like it's your mom or your grandma. So I'm so happy to be treating my mom. Another Sister Roman, Burr?
Yes, I wanted to say I enjoyed it very much. It was very informative and I took away a whole lot of things. Also, I wanted to know, how do you spell the doTERRA?
Yes. You know what? I'm going to put it in the chat for you.
Oh, okay.
Have it. Yes. Thank you for coming.
Hey, I enjoyed it very much.
Yes.
Okay, my husband said me too. He's in the back. He was listening.
And I see your mom here too. Thank you for coming.
Yeah, it was great.
I'm Sister Johnson.
Oh,
Yes. Hi, Sister
Hi.
Johnson. Yes. Hi.
Hi. I see another hand. Is that Karen Hines or Karen?
Yes. Hi. It was a very informative session. I enjoyed. At least I came in a little late, but I did benefit from the aromatherapy section of the discussion, and I also am on the hunt now for that snake plant and aloe. Like you, I don't have a green thumb, but I have a little person. She's just 5 months, and we have sinus issues. So every night we have peppermint and eucalyptus in the diffuser. So they have been helpful in aiding us to breathe properly, but I'm going to try as well the 4-7-8 method. So thanks so much. We appreciate it.
You are welcome. Thank you for joining, and I'm glad it was useful. I think I have time for one more, Sister Johnson. I think I was hearing your voice coming through.
I benefit, and I find was very interesting about the breathing process. To holding in the breath, Kaleen, and let it out at the 8 when I counting. I even tried it, and I find it felt a little good inside. And of course, my daughter has high blood pressure, so I want to introduce it to her and tell her, she should try it. So I appreciate that, and I benefit. Thanks.
Yes, I'm right with you, Sister Johnson. I did it while she was selling it, and I said, I should have done this before. Because getting on camera, oh, my nose. Yeah. So I appreciate it, and thank you for coming back. Thank you all for coming, and I hope you could come next. Kathy, thank you so much, Kathy. I love you, and I hope you could join us next month for our class. And feel free to invite anyone you like. And I am going to stop now. I want to thank those on YouTube. I'm going to stop the live stream now, and I thank you so much for all your love and support. I do love you.
Yeah.
Bye.